I'm Julie Pace, Washington Bureau Chief for the Associated Press, and this is Ground Game. The coronavirus pandemic ranks among one of the most consequential stories ever covered by the Associated Press in its 170-year history. Here to take you inside the outbreak is AP's Ralph Russo.
From the Associated Press, this is Inside the Outbreak. I'm Ralph Russo. Today is Thursday, March 14th. A typhoon in the Philippines has forced the evacuation of tens of thousands of people, further complicating efforts to fight the spread of coronavirus there. Meanwhile, Japan and New Zealand are relaxing social distancing restrictions as the virus is brought under control in those countries. Today on Inside the Outbreak, we'll turn our attention toward rural America, with the writer of an illuminating and heartbreaking story about a sparsely populated corner of southwest Georgia that has been devastated by COVID-19. AP national writer Claire Galofaro, along with an AP photojournalist and videographer, went to Dawson, Georgia, to show how the pandemic is hitting hardest in predominantly African-American communities that are already marginalized by inequities. We'll speak to Claire about how the people of Dawson are coping and what it took to embed herself in a small town where the coronavirus is raging. Claire Galofaro is a national writer and reporter with the Associated Press. She covers politics, poverty, rural America. Claire, thanks so much for joining me today. Really appreciate your time.
Thank you for having me. I appreciate yours too.
Yeah, your story was remarkable in so many ways. So let me start with this. What led you to Southwest Georgia?
Well, I cover a lot of rural communities. And so I had been just really keeping track of how the coronavirus was impacting rural places, how it was spreading outside of cities. I noticed that this patch of Georgia in the southwest corner of Georgia was having extraordinary difficulties with this disease. It had among the highest per capita death rates in the country. And so, we decided to really explore what was happening there and how the virus was affecting rural places and how that was different than urban areas.
So our data analysis by the AP has shown that African Americans are dying from COVID-19 at a disproportionate rate. It seems like that is also the case in Southwest Georgia. And I'm wondering if that was part of your calculation on sort of showing what's going on in that part of the country.
Yeah, it absolutely was, because this area sort of shows on a tiny scale all of the inequalities that has made this virus so deadly for some. This disease has obviously been more devastating for African Americans and other people of color, for the working poor, for people with underlying health conditions that are often tied to generational poverty and lack of access to preventative health care. People who work in places where social distancing isn't possible, like meatpacking plants. And all of that was happening in these tiny, small communities in rural Georgia that are, like so many rural places, suffering through, a series of economic downturns. Factories have closed over the years, and that's left them with a dwindling population, an aging population that has just made these communities so much more vulnerable to this disease.
So Dawson, Georgia was where the dateline was from. What are some of the other counties that you visited and that were sort of make up this area that has been so ravaged by COVID-19?
All of these communities sort of circle the city of Albany, which is in Dougherty County. People described it as like the center of a wheel, and these surrounding rural communities are the spokes. And all of those communities, there are a number of counties. Randolph County is one, Early County is another, that have just been really devastated by this virus. And they all kind of center around the city of Albany, which is where the outbreak is believed to have started. It is the commercial hub for this whole region. It's where people go to do their shopping. A lot of people go there for their health care. It's just where people have to travel to get sort of the basics and then go back to their more rural communities.
So, how did you manage to connect with people there at a time when there is so much angst and fear and sadness? What are the challenges of trying to get people to trust you with their personal stories when you quite literally can't get physically close to them?
I was really worried about that going into this. You have to wear a mask. And so people can't tell that you're smiling at them, and you have to stay away from people. So it is harder to connect with people. And, with stories like this, we're asking them to describe the most intimate details of the worst days of their life. And so I was really concerned about, whether we could do this story justice, given the circumstances we are in right now. But honestly, I think that these people recognized that they were living through this historic moment, that they had an important story to tell, and they wanted the world to really know what was happening to them and to their community. And so it ended up honestly really not being as much of a challenge as I thought it would be. And I think that is because of the courage that these people managed to muster at this sort of incredibly dark time for them. But they really, it was easy, it was really easy in a sense because these people were kind and open and honest about what they had been going through. And I'm extraordinarily grateful to them for that.
Your story begins with Reverend Willard O. Weston giving a eulogy at the funeral service for two members of his congregation. There's no way I could set this up better than your words could. So if you could, would you mind reading the first few paragraphs of your story?
Sure, I'd be happy to. The Reverend approached the makeshift pulpit and asked the Lord to help him make some sense of the scene before him. Two caskets side by side in a small town cemetery, busier now than ever before. Reverend Willard O. Weston had already eulogized other neighbors lost to COVID-19, and he would do more. But this one stood as a symbol to him of all they had lost. The pair of caskets, one powder blue, one white and gold, contained a couple married 30 years who died 2 days apart, at separate hospitals hours from each other, unaware of the other's fate. The day was dark. There was no wind, not even a breeze. It felt to some like the earth had paused for this.
You do a really beautiful job with your writing. I'm wondering if you could tell us, what has Reverend Weston's life been like over the last couple of months?
Well, thank you so much for saying that. Reverend Weston's life for weeks was just a sort of series of these devastating phone calls. It felt like they just came one right after the other for him. News that somebody had died, another person was in the hospital. When he was preparing to host this funeral, about an hour before it was scheduled to start, he got a call that his own first cousin, who he had grown up with, had died. And he described how he just kind of went out into the yard and just pleaded with God to help him figure out how he could go and do this, given just this extraordinary sadness he was feeling himself. He is a man of faith. And so I think the only thing he can do to make it through this, he said, is to just hope that something somehow good is going to come out of this, that all of this death that their community is experiencing has revealed that these incredible inequalities have always existed for rural people and for African Americans. And that, he hopes that this will serve as a lesson to all of us that we can't continue to just accept that this is the way it is, and that we'll have to change it somehow.
Within the story, and even you just made another reference to it, even before the pandemic, there is a sense of abandonment with these communities. So what was it like for them to try to respond to an outbreak when access to medical care and so much else is so limited?
I mean, it's extraordinarily challenging, and it's very different than it is in big cities. A lot of people live an hour from the nearest hospital, which means a family member or a paramedic has to drive them. And then by the time they get to this hospital, it was already full because all of these communities were hit so hard so quickly. So then they had to be flown to another hospital, maybe in Florida or in Texas or in Alabama. And so just the chain of medical care is just so much more fragile for rural people because of, geography, and because so many rural hospitals have closed over the years, that just getting somebody to the hospital can be an extraordinary challenge. And they're sicker by the time they arrive. The hospital was very clear about that when people arrive from more outlying areas, they're just harder to save because that critical amount of time has passed.
This is a good opportunity to go back to the two people that Reverend Weston was eulogizing. I think they're probably a good way to show an example of what you're talking about here. Give us an idea of the couple, the married couple, 30 years married, and what happened when they got sick and how they died.
Yeah, they got sick. The husband got sick first. He was a longtime employee at a food processing plant. He was retired, but had worked really hard his whole life. And they both had some of the underlying health conditions that make this disease so deadly. Both were diabetic. The husband was on dialysis. His wife had an heart surgery. So they both were in fragile health that made them vulnerable to this disease. The husband he was taken to the hospital in Albany and then had to be transported to a different hospital about an hour away. The wife got sick the next day. She also went to the hospital in Albany and then was transferred to another hospital an hour in the other direction. So they ended up being several hours apart as they struggled through COVID. Both of them ended up passing from the disease. The wife's sister also became sick and went to yet another hospital. Their son and their niece were sort of bouncing between all of these hospitals, trying desperately to see them and being told, of course, that they couldn't because it was just too dangerous. And so it became, really painful for the family to know that they were alone and in different hospitals when they passed away.
So you alluded to this before, but do we have any idea of where this outbreak started? Have epidemiologists been able to find the epicenter here?
The outbreak in this part of Georgia is believed to have started at a pair of very large funerals in Albany in late February, and then spread into the rural communities surrounding Albany over time.
I want to get into the process of reporting and writing this story because, as we mentioned before, there was risk to you and the photojournalist and videographer who went with you. How long were you in Dawson, and what type of precautions did you and your colleagues have to take to simply get through a day?
It was tough. And, the part that was scariest for me was the risk that, every person we were talking to, we were, in a sense, putting them at risk, too, because of the circumstances we're in. Just meeting somebody, talking to them. If you don't know that you're carrying the virus, you could be endangering them. So it was a real moral and ethical challenge for us that we spent a lot of time talking about. We had talked with our colleagues who'd been reporting from New York City about safety precautions that they were taking, the lessons that they had learned from being on the field for a long time. So we, bleached our hotel rooms. We used alcohol to clean down our cars multiple times a day. We joked that if we got pulled over, the police officers would surely think we were drunk because they smelled so much like alcohol by the time we were, reached the end of the day from trying to clean them so often. I carried a thermometer and took my temperature multiple times a day just to make sure that I, wasn't coming down with the virus, or to try to make sure anyway.
So again, the story was so well reported and so well written. So I want to ask you, I'm a sports writer full time. I write, I certainly feel a responsibility, as every reporter does, to get a story right and to tell someone else's story well. But I could imagine that there is a certain sense of responsibility, or maybe even pressure, that comes with when you sit down with your notes and your quotes and your research and your data to get this story right. I feel like you did. I think you did a wonderful job, but I'm wondering if you could share whatever that sense of responsibility you felt to when you sat down to write this story.
Sure. And like you, I always feel a real sense of responsibility with a story like this, in a story where people are willing to share such excruciating moments of their lives. I always want to do justice to that, of course, to make it worth it to them. And that sort of anxiety over that was even, I think, more profound for me in this case. Because, these people, like I mentioned earlier, just by meeting us, by speaking with us, were putting themselves at risk because they thought it was worth it at the time. And so I needed to make it worth it for them. And so I did. I mean, that burden was really powerful for me at this time. I think the most powerful moment of this reporting trip for me was when we were meeting with this guy, Eddie Keith. He was a funeral home attendant who knew everyone in town, really. And what part of his job was to pick up the bodies. And without us asking him to, he started singing this song. It's this old spiritual, which is the song he said that helped him through this time.
I'm gonna lay down my burden, throw up my cross, and I'm going home to live with Jesus. Ain't that good news?
And I listened to that song. Like, I listened to him singing it. I was recording at the time. And I listened to him singing it over and over and over again as I was writing the story, because it kind of just put me in that space. Like, it made me, it rooted me in what it felt like to be there. And so that helped me, I think, remember how high the stakes were for them.
In a sense, the story reads like an obituary for a community. But did you come away in some ways hopeful for the people who live in this part of the country? Is that possible?
I guess I have mixed feelings about that. I want to be hopeful. And I think some people are hopeful that this is an opportunity, in a sense, that this horrible event is an opportunity for us to come together as a society and decide how we want to remake ourselves. Like, we have a chance here to do it better, and to see that it can't continue on in the way we've allowed it to continue for so long. But one person who runs the NAACP there in Terrell County, which is the county where Dawson is, he said, we've had challenges before. We've been through hurricanes and floods. And we've always maybe thought that, like, this is an opportunity to do it right. And we haven't really. We haven't used these moments for real and lasting change in the past. And will we this time? I don't know. I think time will tell. And I don't know that we'll be able to know that right away.
Claire Galofaro is a national writer and reporter for the Associated Press. She covers politics and poverty in rural America. She went to the southwest corner of Georgia and reported on a few counties, sparsely populated counties that were just ravaged by COVID-19, and did a beautiful job of that. Thank you for joining me today, Claire. Your insight was great. Please stay healthy and please stay safe.
Thank you so much. You stay healthy too.
At apnews.com, today's One Good Thing feature is a story about a crane operator in Belgium. Tristan van den Bosch's cranes stood idle because of the coronavirus crisis, so he decided to put them to use in a way that had nothing to do with construction. Van den Bosch headed out to care homes where families cannot visit their elderly relatives.
One morning I drove from home to the office, and I saw a man shouting at his mother, 3 stages high, and I said, we can help this man. And so I wrote an email to that care home, and they replied immediately.
From the outside, he was able to lift them up high to the windows of their loved ones for a bird's eye view and a little time to connect. You can read that story and all of AP's coronavirus outbreak coverage at apnews.com.
That's it for this episode of Ground Game. We'll be here every step of the way during this extraordinary moment in American politics and American life, giving you all the news you need to know. Be sure to tell a friend about us, and please subscribe on Apple Podcasts and leave us a review. Some of the details of our discussion may have changed by the time you hear this. For up-to-date developments on all of your news, head over to apnews.com. From the Westwood One Podcast Network.